Hey there, surgical trainees and aspiring surgeons. Welcome back to our comprehensive series on essential surgical skills. Now, let's dive right back into our current video on suturing technique for surgery trainees. Subcuticular suture, again, it is a very good technique, and here, like for the cosmetic result, you don't want any suture mark. We start with simple inverted or buried suture, so we have already discussed in the part 2. So buried suture is applied near to the edge of the wound, and then we divide the shorter end. Now we will basically take a bite beneath the knot so that knot get buried and will come out exactly at the end of this incision between epidermis and dermis. So subcuticular suture or the basically intradermal suture, they are same suture. So this subcutaneous suture, subcuticular suture. Now the technique or trick here will be that you start taking the first bite as close to the end of the wound and take smaller bites. And for taking smaller bites, I have already discussed that then you hold the smaller length of the needle closer to the tip, that is until 1/3 2/3. Then you keep progressing. As you are near to the edge of the wound, then you take smaller bites, and as you progress, then you can take bigger bite, and again when you are approaching the other end, then you have to take smaller bites. So first buried knot, then come at the end, and then we keep progressing. So all the bites take smaller bites, and all the bites are basically through the dermis or epidermis dermis junction. Don't take part of the skin. And again, trick here is the next suture is where you is your exit point. So you simply cross the suture to opposite side, and where you have exited on other side, that will be the entry point on your for other side. I hope you have got the point. So like way we keep progressing. And friends, just remember, as you keep progressing, keep learning, you will find your own unique way, your unique rhythm, and most of you will modify this technique according to your own comfort and your own experience. And these basically are your basically starting point or a simple guide. And then again, you have to learn and do better and better than us. And that is the basically whole aim of teaching. So like way now we have reached the end of the this wound margin. So there are different technique. Now we'll share all the techniques with you guys. So one is that you then take another bite, which is take part of the subcutaneous tissue and come just at right at the corner of this wound, and you take a basically apply a knot, that you simply knot, then you come beneath the knot and through the skin and cut the basically this thread closer to the skin. So I hope you notice that we have simply applied a simple knot and then cut. And another technique for you guys will be, so when you have reached the end, we don't apply any knot, we simply come out. This is, I think this is called jet technique. Then you take right, then again a bite closer to the skin and another bite closer to the skin. So the sort of jet you make, and there's no knotting here, and it will hold beautifully. And this is one of my favorite technique, and it won't slip out if you have followed this technique already. Another method of closure for subcuticular technique will be, you can simply apply a knot on this thread and pull the end closer to the wound, and you cut it here. So this is another technique, and it will automatically fall, because most of the time here, for the sake of demonstration, we are using Proline. Otherwise you will be using the monocryl, so it will automatically fall. Another technique for you guys will be, if you don't want to apply any knot, then you start the basic closer, subcuticular closer from one end, and come through the normal skin and leave this short length of the suture. Then you continue this, and suppose you have suture the whole length and you come to the another end, Then again you come out of the this another end and keep a basically a roll of gauze. Here for the sake of demonstration I am using this basically suture leaflet. Otherwise you will keep here a roll of gauze and loosely tie this two ends over this roll of gauze and apply the dressing, and you can simply cut these basically suture after 3-4 days or 5 days, and it will heal beautifully. So friends, just remember that every stitch you make brings you one step closer to mastery. Embrace the challenge, embrace the journey, and become the skilled surgeon you aspire to be.